Chapter 11, Single Case, Quasi-Experimental, and Developmental Research. This chapter looks at other research techniques that can be used when an experiment isn't feasible or doesn't fit the question that's being asked. Single-case experimental designs allow for cause and effect inferences to be drawn from data based on one or a small number of research participants. This is also called a single subject design or a small n design, and is often used in applied behavior analysis to see if an experimental manipulation has an effect on a participant. For this type of design, you would start by measuring a baseline, adding a manipulation or treatment, and measuring the change. For instance, maybe you're working in an elementary school setting, and there is one child who is severely behind in reading compared to the rest of the class. So you look at their current reading scores on a standardized test and design an intervention just for them. In this type of design, you're not typically controlling for many variables. Yes, you might work with the child on the same days for the same amount of time each week to give some level of control, but you're not controlling for how much the child reads at home or how skilled their teacher is. The data are relatively simple compared to other designs we've talked about in this class. We also have what's called a reversal design. This is also sometimes called a withdrawal design, where the treatment is introduced after a baseline period and then withdrawn during the second baseline period. So, what happens when the treatment is there and what happens when it is not? Maybe we take away the reading intervention after implementing it to see how well the child does without it. We call this an ABA design, where A is the first baseline period, B is the treatment period, and A is the second baseline period. And you can tell that the word baseline is used a little differently here compared to previous lectures. It's just a period of control when the treatment is not present. And you can have even more levels of treatment and baseline here, depending on what you're wanting to study. You might have an ABAB design or an ABABA design, and so on and so forth. Here is an example of an ABA design where we have a number of correct homework problems as a function of time. Say the treatment here is candy for correct answers. You can see that candy increases correct answers on homework problems for this particular child. However, there are two ways in which this behavior may manifest. On the left, when no incentive is present, there is this sharp decrease in the number of correct responses. This might show that the child knows how to solve the problems, but isn't putting in any effort because there's no reward. Versus on the right, you can see that this performance still decreases, but it's not as low as it originally was. Maybe this shows that the child is trying to understand the information, but incentives also help out with that process. The inferences you can make from this data might affect the next steps you take when working with this child. And as stated, we can also create an ABAB design in which baseline and treatments are measured multiple times. You can see that the treatments or incentive for correct answers consistently increases number of correct homework problems when present. It's not a one-off thing, but something that may be fairly consistent for this child. The problem with reversal designs is that they're not always ethical. You can easily stop providing candy for right answers, but if you are interested in whether medication is helping someone to feel better, you wouldn't want to just take them off that medication and see if they feel bad again. Or maybe you have a treatment to reduce average crime rates. You wouldn't want to stop that and see if crime goes up again. One of the ways we can account for this is with a multiple baseline design, where we are observing behavior before and after manipulation under multiple circumstances. This has a similar setup to before, but we are examining different individuals' behaviors or settings. Maybe we try our crime intervention in multiple settings and communities to see if we can replicate that effect. As you can imagine, replication is really key here for generalizability, just like any other study. Here is a visual of a multiple baseline design looking at number of cigarettes as a function of time for 3 different participants. So instead of taking someone off a treatment and seeing if they start smoking again, we can look at multiple people and see if it is the treatment that is reducing smoking and if the amount of time spent smoking or in treatment matters. And it's important to note here, we are looking at these participants individually. We are not looking at averages as we would in other types of studies. A quasi-experimental design is a design that approximates the control features of true experiments to infer that a given treatment did have its intended effect. This design is typically used when we cannot randomly assign people to different conditions. Maybe we want to measure people with and without a specific illness, or we want to measure young people versus elderly people, or men versus women. These are not groups that we can randomly assign people to, right? And because of that, it's harder to draw causal inference. We have to interpret these findings with caution. We are going to talk about different types of quasi-experimental designs. The first kind being a one-group post-test only design, where there is no control group or pre-test comparison. Participants are just provided with a variable of interest and the outcome is measured. The example on the slide is participants sitting next to a stranger and measuring the time until the stranger leaves. Making this quasi-experimental, maybe we are interested in whether people stay longer when a man or woman sits next to them. This type of study has poor internal validity because we are only measuring the independent variable once. We don't have information on how long that participant would have normally sat on the bench or how long they were sitting before the participant showed up to know if that independent variable had any effect at all on that dependent variable. We also have one group pre-test post-test designs where the effect of an independent variable is inferred from the pre-test post-test difference in a single group. This is an example from an earlier lecture in which we are measuring participants' smoking behavior before and after a smoking intervention. Having a pretest measure increases internal validity and our confidence in the training program. Because if we only had a post-test measure, we wouldn't be able to know if it was the training program or if the participants just wanted to stop smoking anyway. And because the participants were smokers and we are not assigning that category to them, this is a quasi-experimental design. But again, we have to be careful because there are a number of alternative explanations that threaten our internal validity. There are history effects, where any outside event that is not part of the manipulation could be responsible for the results. Did the smoking intervention reduce smoking behavior? Or did they recruit people who already wanted to reduce their smoking and were using alternative methods such as nicotine gum to reduce their smoking? There are maturation effects, which are the possibility that any naturally occurring change within the individual is responsible for the results. In other words, people can change over time. For instance, we know that drinking behavior tends to increase in college and decrease after graduation. If we are trying to reduce younger individuals' drinking behavior and we have a longitudinal study that follows participants post-college graduation, it might look like that intervention was really effective when in actuality it was just a natural progression as people settle into their adult lives. We have testing effects, where taking a pretest changes behavior without any effect of the independent variable. If you have a math test and give that test twice, people might perform better the second time because they've practiced those questions. If we ask people about their smoking behavior before having them take part in a smoking intervention, they might be more aware of their behavior and that might change the results. We also have instrument decay, which is when a change in the characteristics of the measurement is responsible for the results. Do you have a comparable math test that has different problems with the same difficulty level? If you have observers for a study, do they get tired over time and count behaviors differently? This is essentially how good is your measurement of the dependent variable. We also have regression towards the mean, where extreme scores on a variable tend to be closer to the mean when a second measurement is made. If we want to retest someone who is an extreme outlier on a specific measure, they are not likely to score as high the second time they take that test. Essentially, is the change due to a manipulation, or is it just because people tend to be average? All of these considerations can at least partially be accounted for using a control group, which is why single group designs have such a limitation. There are different ways to implement a control group, one of which is a non-equivalent control group design, where non-equivalent or non-equal groups of subjects participate in different experimental groups and there is no pretest. Essentially, there is a control group, but no random assignments and no pretest for comparison. The image here shows a training program or no training program, and then a smoking measure is given as a dependent variable. If there is no random assignment, say participants are allowed to choose their groups, there may be selection differences, which are differences in the type of subjects who make up each group in an experimental design. Like before, maybe people who really want to quit smoking sign up for the treatment group. There are also ex post facto designs, where participants are placed into groups based on prior experience. Maybe we're interested in the number of times people have tried to stop smoking, and if they have never tried to stop, they are placed in the treatment group to be compared to the people who have tried to quit multiple times. Again, this can lead to some selection differences between groups. We can also use a non-equivalent control group pretest post-test design where we have the same non-equivalent groups, maybe people sign up themselves, but at least we can compare before and after using a pretest and a post-test. Sometimes pretests are different, like the math example, you might be given slightly different problems or questions, but that comparison does increase the internal validity of the study. There's also propensity score matching of non-equivalent treatment and control groups, where we pair individuals for assignment to a treatment and control condition based on a combination of scores of participant variables. This is essentially a match pairs design, which we've talked about before, but without random assignments. Maybe we find two people who smoke similar amounts, and we see that one person has signed up for the treatment condition and the other has signed up for the control. We aren't assigning them or making them smoke a certain amount, but it does allow for comparison. There are also interrupted time series designs where the effectiveness of a treatment is determined by examining a series of measurements made over an extended time period, both before and after the treatment is introduced. Maybe we're interested in the number of car accidents before and after a stoplight is installed. Instead of looking right before and right after, maybe we look at a few years before and a few years after. So we know it wasn't just a few weeks of bad weather or other variables driving that data. A control series design is an extension of the interrupted time series design in which there's a comparison or a control group. Using that traffic light example, maybe a similar intersection does not get a traffic light, and then we can compare accidents over that same time period. Developmental research designs tend to examine how people change over the course of their lives. And there's different ways to do this. We can use a cross-sectional design where persons of different ages are studied only at one point in time. This is conceptually similar to an independent groups design, but our groups here are based on age. Maybe we're interested in cognitive development and measured 10-year-olds, 20-year-olds, and 30-year-olds to examine that change. If we do this, we have to interpret the results with caution because we are comparing different groups of people. We are not comparing people to their past selves. One thing that can affect the data are cohort effects, which are differences among age groups attributed to cohort rather than age. And a cohort is just a group of people born at the same time and exposed to the same societal events. So if we look at embracing technology, the 10-year-olds might use technology more than older adults. Not because older adults don't necessarily want to embrace new things, but because they didn't grow up with it. To account for this, we might consider using a longitudinal design, where the same persons are observed repeatedly as they grow older. This is conceptually similar to a repeated measures design because we are taking people, measuring them maybe every year, every 5 years, 10 years, for a given duration of time. This allows us to see how people change over the course of their own lives, and we can compare them to their past selves as opposed to other people. As you can imagine, this is quite time consuming, and people do tend to drop out as the study goes on. And this also doesn't completely get rid of cohort effects, because if everyone in your study was born in 1980, that itself is a cohort, and these individuals probably had a different childhood than children growing up today. We can, however, combine these methods using a sequential method, which is a combination of the cross-sectional and longitudinal designs. Maybe you take children born in both 1970 and in 1980 and measure them at 3 time points with 5 years between measurement periods. This way, you can compare children both to their past selves and to others from a different cohort. So we can say that the effects found are not due to the specific year people were born. For the activity this week, you'll read the following passage and then answer the questions below. Dr. Cardenas studied political attitudes among different groups of 20, 40, and 60-year-olds. Political attitudes were found to be most conservative in the 60-year-old group and least conservative in the 20-year-old group. So 1, what type of research method was used in the study? 2, what are 2 advantages of this design? 3, should you conclude that people become more politically conservative as they get older? Why or why not? And 4, propose an alternative way of studying change in political views over time and describe what could be learned with this new method.